The effectiveness of coronavirus lockdowns are in question this morning as Victoria records its biggest spike in cases yet. 2 weeks since Melbourne hotspots were given stay-at-home orders. Dr. Vyom Sharma is a GP practicing in Melbourne and he joins us now. It is so worrying. The lockdown appears not to be working.
Well, I think it's still a bit too early to tell. In fact, there are some good signs. So, yes, we're seeing more record-breaking numbers, but we're seeing that the rate of spread seems to be coming down. That's that reproduction number that we talk about. Also, there's data showing that, from the mobility data, showing that the number of contacts people are having is less. In fact, even the people they're finding who are infected with COVID-19 when they're contact tracing them have been in contact with less people. So, of course, we're all worried about this, stage 4 lockdowns that's threatened, but I think if we continue to see more plateauing, that'll be good. We should be optimistic that hopefully things can turn around next week. Otherwise, if not, stage 4 it is.
So I mean, we wait and we listen to those press conferences with Dan Andrews in Victoria every day. And with a great deal of concern, we wait for the figures. We see those numbers going up. Why is it that health professionals aren't as nervous as we all are about those numbers increasing? Is it because of what you just mentioned?
No, we are nervous, for sure. And we know that even with the numbers so far, the wave of hospitalisations is really going to hit in a week or two's time. But looking at the trends, the rate of increase is slowing down. So that is good. But the point is, we do need to see much more developments there. But don't worry about that. We're nervous enough with what's coming.
I read something interesting about this virus yesterday, that someone who had contracted the virus had an incredibly strong strain of it. Is it different for each person, and is it evolving?
So I think this concern about this strain was because the person incubated the virus very quickly.
Yeah.
They were exposed and then they got the symptoms quicker. No, this is actually fitting into the normal spectrum of what we expect. Yeah, so it's the incubation period being from 2 to 14 days. There's no evidence that any of the strains of the virus we're seeing are any stronger at all. Some are more common than others. That doesn't mean they're stronger.
I also note with interest today that inside aged care facilities, they're making it mandatory to wear face masks. I don't know how this didn't happen, right? I mean, how do you even explain that?
No, I've been very upset about this. I can't believe the directive has come so incredibly late. The right time for mandatory masks in hospitals and aged care was about maybe the start of July, near the end of June, when we knew things were picking up. I have no idea why authorities were so slack with this. Masks have just been like Voldemort to them. They just haven't wanted to say the word because it's a complex piece of health communication. And we paid the price with hundreds of healthcare workers in Victoria being in quarantine. They're coming out now, but the government's been, frankly, terrible on this.
What should other states be doing now in order to stop this virus spreading? New South Wales obviously under pressure at the moment.
Yeah, the funny thing is the states almost always do the right thing, just about a couple of weeks too late. So I don't know why New South Wales was a bit slow with the bans of travel from Melbourne. Even now, for example, Star City, there was a positive case there in the casino, I understand, and that's not been closed down. I heard just before the cross, 300 is the limit in pubs. I'm a bit doubtful about these things. There's always a bit of room to move, and I think a lot of the other states are underestimating what's happening in Victoria. Okay. Meanwhile, in Western Australia, you've got AFL games happening when a woman from Melbourne broke quarantine just recently. I think there's a bit of underestimation here that we can't afford.
It's incredibly hard psychologically, I think, for people in Victoria to even watch a game with people at it. I mean, there are so many different tiers of speed at the moment, aren't there? Doctor, I really appreciate your time. You shed light on some of those difficult matters this morning. Appreciate it.
Thank you.
Over to you, Ali.